Now, what we're going to discuss now is that we're going to discuss about the physiology of this micturations, okay? And what is micturation, guys? Do you guys know what micturation? Micturation basically means is that, okay, the discharge of urine from the urinary bladder, okay? We call them, another name for micturation is called, okay, voiding. You can say voiding too, okay? You can say voiding, or you can call this as what? You can also say urinations, whatever you like to call, all right? That's what is happening here. Now let's say, okay, let's say from here, the urine is coming out and it's draining here, right? That's what is going to happen. So let's say that, okay, you focus here. What is going to happen here is that, you know, let's talk about this is your, let's say this is empty, and let's say, and we'll use this as your, let's say it's full, okay? Because that's what we're talking about. We have to talk about storage reflex, okay? Which basically means we're talking about when the bladder is empty, okay, what is going to happen? And when, let's say, when the bladder is filled, okay, what is going to happen? That's what we'll discuss about, okay? So micturition reflex and versus the stress reflex. We have to talk about both of them, all right? Now, so let's say, okay, the urine right here, okay? So we'll say this urine is accumulating right here, okay? And it's just accumulating down here, okay? So what is going to happen is that it's about, all right, and this urine is like, you know, it's about like, let's say, like 20 ml, or maybe we can say like a 30 ml of the urine is there, okay? So not much urine is present, a little bit. So whenever there's a less urine is there, okay, this, you know, this muscle in the blue right here, you guys see this? These are called detrusor muscles, right? These detrusor muscles, okay, these detrusor muscles, which have 3 different layers, right? They have receptors, okay? These are called stretch receptors. What do we call that? We call them stretch receptors. Let's write down here. It's called stretch, okay? You call them a stretch receptor. All right. Now, what is the properties? What is the stress receptor do? What happens is that, okay, whenever there is, let's say, only 20 to 30 ml of the urine is there, that means these stress receptors are not going to get a stretch. You know, the detrusor muscles, they're not going to get a stretch, right? So when they don't get stressed, what is that going to do is that, okay, when they don't get stressed, what is that going to do is that, okay, that's not going to cause any stretch onto this receptor, okay? And what is going to, let's just take this from here, okay? There's a 1 here, and then we'll make this as 2, and then 3 here, and we're bringing this nerve fiber right here, okay? Look, this is going to happen, okay? And what is this bringing right here from here? Okay, this is bringing, okay, what is it bringing? It is bringing the, okay, afferent, okay? These are called afferent. That's what it is bringing. Afferent impulses is carrying, right? But this afferent is from the stress receptor, okay? But this is very low, okay? It's not stress as a, and what is going to happen? It's going to bounce into this guy, which is called dorsal root of ganglion, right? So you can simply say this is a dorsal root of ganglion, right? Now from here, what is going to happen is that it's going to go, and guys, remember, we have to talk about this, okay? This is look, this is your brain, right? So like this is your brain right here. This is going to be a midbrain. This is going to be a pons right here, medulla right here, and I also do a little bit of, like say, you know, cut down of cervical right here. And this is your lumbar regions. We have to talk about lumbar regions. And then this is your sacral regions, okay? So this is sacral spinal cord, this is lumbar spinal cord, and this cervical spinal cord. And whenever we talk about this storage reflex or micturition reflex, okay? Whenever we're talking about this, you know, it's really important to the lumbar regions of knowing about from, let's say, T10, okay? Let's just write down the T10 or T11 to, let's say, L3 level, okay? It's really important to know that. And from the sacral regions, they're giving a fibers from your S2, S3, and your S4, okay? So you have to remember this 3 portion. Now, all right, that's what it is. Now, what is happening here is the sacral regions, this guy is gonna go, look, is bringing the, what is afferent afferent impulses, okay? Which are very, very, like very low, okay? So it's bringing right here, and it's get what? It reports to the dorsal ganglions, and then from there, what is going to happen is it is going to come back here. And remember, this is what dorsal horn right here, right? And here, it's going to relay to the dorsal horn. Okay, that's what it's going to do. And then something else is going to pick up from here. Okay, let's just write down, you know, different color. Okay, something else is going to pick up here from here. Okay, this is going to carry, because this is going to carry signals, and it's going to bring it to up here. Okay, it's going to go right down here. Look, it's going to go up down here, and this is going to go to the lumbar regions. Okay, when it goes to lumbar region, look, what is this? This is a dorsal horn, this is a ventral horn, right? You guys know this, right? So dorsal, let's write down for you guys. Dorsal horn, okay? And or you can say posterior horn, and this is what? Ventral horn, right? You guys know this, right? Now, what's going to happen? There's a stimulator, let's write it down here. They're going to stimulate the, nuclei down here with the positive stimulations, okay? That's what these guys are going to do. Now, when they guys stimulate the positive, what is going to happen is that, okay, they're going to give us sympathetic fibers from right here. Let's just make the sympathetic fibers here, okay? The coming of sympathetic fibers. So let's make this as a synapses right here, okay? And gives a stimulations down here, okay? And it brings this this is sympathetic because it's the lumbar regions, okay? It's going to bring us sympathetic fibers here, okay? And this sympathetic fibers, that's going to get synapse, okay? Let's make this as, okay, we'll make this as, at this ganglion, okay? And what is this ganglion is called, okay? This ganglion is called, we'll write down, inferior, okay? It's a hypogastric ganglion, all right? Look. It is inferior hypogastric ganglion. So when these guys, okay, it stimulates as the inferior hypogastric ganglion right here, right? This is a sympathetic nerve fibers, right? We'll write down sympathetic here, okay? And then from here, okay, it's gonna go, okay, and then go and work onto this detrusor muscle right here. It's gonna relay in this detrusor muscle right here, okay? Now, these detrusor muscles have they have a receptor for the sympathetic fibers. And that is because it's sympathetic, it is with the beta 3, okay, adrenergic receptors, okay. These beta 3 adrenergic receptors, they're also beta 2 adrenergic receptor too, okay. But it's more abundantly, this beta 3 adrenergic receptor is present here. So when beta 3, when it's bind here at the beta 3 receptors and releases norepinephrine, okay. So when it releases norepinephrine, what is that going to do? You know, what happens is that, you know, it stimulates this detrusor muscles, okay, that causes this detrusor muscle, okay, to hyperpolarize, meaning that lots of potassium will start leaving out, causing this detrusor muscle to relax. Okay, so ultimate result is that there's a relaxations of this detrusor muscles happens. Okay, so result here is that, okay, let's write down here, or let's write down in red. Relaxations happens. Okay, and that's what we want to happen to right here, right? We don't want this to contract because we just want to feel, because this is empty bladder, or there's only like 20 ml or 30 ml of urine is there, right? Now that's what it does. But not only that, it does there. You know, this guys, okay, this is a postsynaptic nerve, right? So specific when it's let's say when this presympathetic neuron that actually, you know, synapses here at this ganglia, inferior hypogastric ganglia, we call a specific name for this is called hypogastric nerve, okay? Hypogastric nerve. Okay, this is called hypogastric nerve. Now this hypogastric nerve, okay, not only here, this also hypogastric comes down here, right here, look. You follow me here, hypogastric comes and works onto this guy right here. What is this? This is called this is my what? This is my internal, right? Internal urethral sphincter, right? That's what it is. Right? So here it comes here right here, but here, this hypogastric nerve with sympathetic nerves, okay, they have receptor here for the internal sphincter also. But this is not associated with the beta 3. This is with the alpha 1 adrenergic receptors, okay? And what it does is that this alpha 1 adrenergic receptor, you know, it causes the by stimulating because they're smooth muscle cells, they're involuntary, okay? By stimulating these cells, okay, this internal, because they're smooth muscle cells, right? It causes to have, like, you know, more cross-cycle bridges form, and then ultimately there's a contraction will happen. So it causes the contractions here, okay? That's what it does. Now, that's what these guys do. Again, let's repeat one more time, okay? Look, these guys, okay, there's a less this impulse is going through this stress receptor, okay? This stress receptor which is carrying this, okay, these are called pelvic nerves, okay? These are called pelvic it's called pelvic nerves, okay, which is bringing the afferent, okay, afferent impulses. That's what it is, okay. Because it's not stretched much, okay, it is reporting like less stretch, okay. So less stretch that is going and relaying in the dorsal root ganglia. Then after that, it is this dorsal relay ganglia is reporting to the dorsal horn, and their synapses happens here, and it's going upward, okay. As it's going upward, okay, what happens is that this action relay the signals to this neuron, the sympathetic neurons, okay, and then sympathetic neurons, what happens? That gets activated, and then this sympathetic nerves comes here, okay, synapses are the inferior hypogastric ganglia, okay, and then this guy, which is a hypogastric nerve, it goes and works with the detrusor muscles, which is a beta-3 adrenergic receptors, and what happens? It causes the relaxations of this detrusor muscles, okay, that's what it does. And then it also goes to this guy right here, internal sphincter, binds with the alpha-1 adrenergic receptors, where it releases norepinephrine and causes the contractions of this internal sphincter, internal uterine sphincters. So we can simply say this is like now, okay, there is a contraction. Let's say this is a closed now. We can say this is a closed now here, okay? Because the urine cannot come out. That's what it does. Now what is going to happen? Now, not only this has happened here, okay? Also what happens is that these guys, okay, because it has to go to the brain too, right? So what happens is that these guys will bring signals down here and go all the way down right here, look. It go all the way down here, it passes the cervical, okay? It goes all the way down here right here. And down here, okay, guys, look. In your pons area, okay, the special nucleus that's present here, and let's write it in this nucleus right here, okay? This is gonna be, okay, we'll make this as more like this shape, okay? It's like ash, like look at this. Okay, this guy right here, this is called, what is this called? This is called, right down here, pontine, okay, storage center. Okay, that's what it is. Now, what happens is that it relays the signals at this pontine storage centers, okay? That's what is going to happen. And also, not only that, and after that, it's going to keep going up there too, goes to the brain, and it goes to the, okay, we can make this cortex, we'll make this a prefrontal cortex, okay, it goes to the prefrontal cortex right here, okay? That's what it is. Because ultimate result is what? It's going to go to the brain too, right? So it's going to go to this there right here, okay? It's going to relay the signals to what? The pontine storage center, okay? That's what we say this is a storage reflex, okay? So whenever we talk about this reflexes of the urinary bladder, okay, we have to talk about two things. One way is an involuntary way, okay, which is done by the spinal cord, and the brain does so-called voluntary, okay. So we call them as this is a supraspinal cord, this is a supra with the brain, okay, which is supraspinal control, okay. And other one is your so-called this is done by the spinal cord, so this is called spinal cord, which is involuntary, okay. So let's just write a spinal cord, which is an involuntary control. All right, and this is a voluntary. Right, now, so what is going to happen here now? Now, really what happens is that, okay, this guy, okay, from the prefrontal cortex, okay, what happens? That's going to release signals, okay. What is that? What kind of signal that's going to release? This is going to release signals from here, and we'll draw in a black, okay, let me draw it. From here, let's just make, goes to this, okay, release signals down here, goes to, and then this from the signals down, and then also gives a signal to this storage centers, and from down here, okay, the fibers come down here, look. It come all the way down, comes down here, okay. Let's make this as down here, okay. And what it does is that it comes all the way down, right, look, it's keep coming down, keep coming down, keep coming down right here, okay. It coming down, and then really what happens, let's make down here. It comes down here, okay, look, and it really signals down here, okay. Now, what is it doing here? Because this is coming all the way down here, okay, from the brain, okay, and then from your pontine storage centers, give a fibers, because this is going to talk to this brain, and then from the storage centers, come all these fibers, actions coming all the way down, okay. And what is going to happen is it relay signals down here, okay, the special neurons that are present here, okay. And what is going to happen? That is actually bringing somatic control. Okay, this is a somatic nervous systems. Okay, and this is, okay, there's a special name is given here because that is arising from S2, S3, and S4. Okay, we call them a pudendal nerve. Okay, pudendal nerve. And what's going to do? This pudendal nerve comes, okay, and it works on this guys right here, external urethral muscles. Okay, these are called external. Look, these are external urethral muscles right here, right? This is the urogenital diaphragm right here. It works down here. Okay, and what happens is there's a special receptor present here, which are called nicotine. Okay, it's a type 1 receptor. Okay, and here when it comes here, what happens? It releases acetylcholine down here. Okay, this is going to be pudendal nerve. Okay, come down here. Okay, which is this guy, which is coming from your potential centers. All these are coming down here. That relay the signals down here, right here. Okay, which are relay the signals to somatic neurons that carries the somatic controls through these pudendal nerves. Okay, and these pudendal nerves with the nicotinic receptors. Okay, because it has this striatal muscles, a nicotinic receptor, it releases acetylcholine, right? And acetylcholine releases, causing, what is that going to do? Causing the contractions of this muscles. That's what it is doing. But guys, not only this, not only this fiber, these descending fibers, okay, stimulate this somatic neurons. Also this guy right here. You see what is this guy right here? Okay, we'll make it a different color here. Whenever this is less fibers are coming down here, one fiber goes and stimulates the sympathetic nervous system through the hypogastric nerve. Also, what happens is that there's also one more signal that is giving to some neurons down here, okay, and that gives rise down here and stimulate this further, the somatic neurons. Okay, what is this called? These are called interneurons. Okay, these are called reflex arc. Okay, we have to talk about that too. Okay, reflex arc. Okay. So what happens is like from here, okay, the two relaying signal is going on in the dorsal horn. One that is going to bring the fibers to the, okay, lumbar cord. Other one is, what is going to happen is that the spinal cord is going to talk to the ventral horn right here of the somatic motor neurons and relay its signals. So that way, the pudendal nerve activity gets enhanced and this go, and what happens? Binds with the nicotinic receptors, okay, release acetylcholine and the further contraction happens, okay. This pudendal nerve activity is voluntary because remember, it came from what? Your prefrontal cortex, right? The cortex of the nervous system. Okay, so it is reporting, it is giving all the descending fibers and bringing this activity, causing the further constriction. And this is happening. This is what happens when, let's say, when your bladder is not filled, or let's say when your bladder is empty, meaning that there's not a lot of urine is present on your bladder, okay? So that is what is happening, okay? So remember, we always have to discuss about the voluntary control and involuntary control, okay? And remember, this guy's right here, as I said, this external urethra, the sphincter, it is somatic control, it's a voluntary control, okay? You make the decision, so when you want to avoid or not, all right? That's what it is. Now, this is all about when your bladder is, let's say, less stretched, or the pressure in this, okay, the volume of the urine is not accumulating here, because whenever the volume of the urine accumulates, what happens? That causes pressure right here, right? But here, in this case, there's no pressure is there, okay? There's less pressure there because of there's a less electrical impulses that is firing, okay? So because of that, okay, there's activity of the, what is this? Hypogastric nerve increases, which has the sympathetic nervous systems, okay? Now that's what it is. Now after that, okay, let's talk about this guy right here. Okay, here let's say now that, this bladder is like, filling up, okay? So lots of urine is coming down from here, okay? So what happened is filling up. So let's just write it down here. It's lots of filling up right here, okay? So whenever this, let's say, urine is filling up, let's say this is going up to, because usually, guys, like, varies from person to person, but like usually about, let's say, whenever you get like 250 to like 300 ml of the urine, okay, this is where you feel like, there's an urgency to go to the bathroom, okay? Or urgency to go to the bathroom. That's what it is, right? So let's say that this urine is filling up, okay? And whenever this urine is filling up, what is going to happen is that, okay, that's going to cause a pressure to develop, okay? That's going to cause this internal pressure inside, that's going to go up, okay? That's going to create a tension on this wall, okay, in the muscular wall of your bladder. So whenever there's a tension develops on your urinary bladder, what is going to happen? That's going to cause, okay, this muscles to get stretched, okay? And as we know that we've discussed, there's a stretch receptor down here, right? The stretch receptor, look, there's a stretch receptors, right? These stretch receptors are going to sense it, okay? There is like stretches there. And they're going to bring, whenever they stretch, these guys are going to bring a report to something else, okay? And they're going to obviously synapse out this guy. Remember, this has to do with this is a pudendal nerve, okay? That is actually bringing the sensory afferent fibers here, okay? And because it's now a stretch, what is that? Let's say make an arrow, there's a stretches there, okay? That means we need to void, we need to go to the bathroom here, right? So what's going to happen? It's going to bring the signals down here, okay? And then relay to this, again, sacral region, right? This is sacral. Relay here, okay? And relay here, okay? Now this is a dorsal horn. Now what is going to happen here? Now, all right? Now what's going to happen is, as soon as when this goes up, all right, what is going to happen is that this is going to, let's make this in red, okay? This is going to bring, okay? This is going to bring afferent signals all the way to brain right here. Look, it's going to go all the way down, okay? It's going to go. But remember, the point being you need to remember is that this guy, I hope you're following me down here, okay? It's really important to understand. It does not stimulate the lumbar regions, okay? It does not, it just bypasses this lumbar region. Let me just make it, okay? Just bypasses here, okay? That's right. It just bypasses this lumbar region right here, okay? It goes all the way down, all the way, and it goes to pass the cervical regions, all the way go up. And remember, guys, it also passes, there's one more center down here, okay? We'll talk about this. There's one more center. It even look, what is this? This is a storage center, right? The pontine storage center. Even it bypasses this pontine storage center. It just keeps going up. And it goes and it actually synapses down here, okay? Isn't that interesting? What is that called? This is called, okay, Periaqueductal gray, okay? Remember, guys, it's always, okay, whenever this guy's stretch happens, okay, this stretch receptor will go and synapses at the dorsal horn, and then bring the axon fibers, okay, all the way to the first, it will go to the periaqueductal gray, okay, because remember, periaqueductal grays are very important for sensing the pain, okay. That's the reason why, remember, whenever you feel discomfort, whenever there's a, bladder is filling up, you feel discomfort, okay, you need to void, okay. So first it reports to the periaqueductal gray, okay. And from the periaqueductal gray, what is going to happen? Okay, that is going to go to the prefrontal cortex, right? Even like there is a anterior, okay, cingulate gyri, okay. Remember our anterior cingulate cortex, and these are really important for what? Making the emotional decisions, right? They're important for knowing the pain, right? Not only, and then what is going to happen? That's going to give a, so this guy's anterior cingulate and also prefrontal cortex, right? The cortex of nervous systems, right? They're going to give a fibers, right? That's what they're going to give a fibers, okay, to the, again, descending fibers to periaqueductal gray, okay? That's what it is. Because they're going to sense it, and this is going to report to the brain, okay? And then you'll know there's a pain or you need to void, right? And then from the prefrontal cortex, it gives the signals down here. And these signals relay down here on the periaqueductal gray, okay? Now, let's make it the blue. This is descending fibers right here, okay? Relay on this, let's say this is my periaqueductal gray right here, okay? Relay here. And when it's relay the signal, what happens? From the periaqueductal gray, this sympathetic fibers comes down here. Okay, because remember, this arrow, okay, let's make this as arrow here. It is bringing upward right here, okay? That's what it's doing, right? It is bringing upward right here, all right? That's what it is doing. It is bringing upward. Now, these guys, okay, these fibers come down here, okay? What is going to happen? As this is going up here, from the periaqueductal gray, they relay this signal to this guy right here. What is this guy? Right here. That's a positive sign, okay? Stimulus. This is something that you guys have to remember. This is called my pontine, okay? It's called micturition center or reflex, whatever you guys want to call. Okay, it's called pontin micturition center. That's what which is located in the pons. Okay, so what happens? The fibers from the prefrontal cortex that is coming down here. Okay, and the anterior cingulate also from cerebellum and all. So what is going to happen? That is going to come down, stimulate the periaqueductal gray, which is located in the midbrain. That is going to this periaqueducal gray will send the fibers to this pontin micturition centers. Okay, and then pontin micturition center is going to send now descending fibers. Okay, all the way, look, descending from all the way down. And look, just follow me here, this blue, okay, it's coming down here, okay? This blue line is coming down here. And look, when it goes down here, look, in the spinal cord, okay, this is my lumbar region, right? What happens is that it gives us signals down here, okay? It gives signals to this guy right here. Okay, what is the signals? Okay, this is inhibitory signals, okay? What is going to happen is that this pontin micturition center comes down here, and as this come down here, okay, in the lumbar region, it's gonna give negative signals to this or stimulate the sympathetic neurons to get inhibited. So that way, what happens is that there's no longer relaxation happens in these small muscle cells. Okay, so really what is happening is coming down here, this descending fibers from the pontin micturition centers, and it inhibits the sympathetic, or let's say it inhibits the hypogastric nerve, okay? It tells hypogastric nerve to, not to, relax, not to release norepinephrine on this muscle, okay? It does, so it is inhibiting the relaxation, okay? That's what these guys are doing, okay? Now, not only that, this also further comes down here, okay? It keeps coming down here, all the way come down here, okay? And what it does is that, okay, it does, you see these guys right here, the pudendal nerve right here, okay? What is going to happen? It's going to relay signals down here, okay? It's going to relay signals down here, okay? But before we talk about this, in the sacral nerves right here, okay, we'll talk about this something else. What is going to, as this coming down here, okay, the special type of neurons that are present down here, okay? These neurons has to do with the parasympathetic, okay? What happens is that these guys, okay, relay right here, relay at two positions, okay? One is here, okay, and then one is, let's say, here, right here. Okay, and these guys are associated with the parasympathetic neurons, okay? And this is go, and then what happens? These are, let's say, parasympathetic neurons, okay? What is going to happen is that the special ganglion first they're going to synapse here, okay? And what is this ganglion right here? These ganglions are called, okay, it's called pelvic ganglion. Okay, that's what it does. So look, so again, the descending fiber from the pontin micturition center, as it's coming down, okay, one, it gives a signal to the sympathetic nerves to get inhibited, okay, and also when it is coming down in the sacral region, what happens is it stimulates those neurons that has to do with the parasympathetic fibers, okay, and from the parasympathetic fiber, this nerve comes out, okay, and these nerves we call them a pelvic nerve, okay. What is it called? We call them a pelvic nerve, and this is at the level of S2 again, S3, and S4. Guys, remember, these pelvic nerves are parasympathetic nerves. They are not somatic, okay, the pelvic. So these pelvic nerves is going to go, let me make this simple. Look, it's going to go right here, okay? And then let's make this up. And work on the detrusor muscle right here, okay? Let's make 3 of them, okay? It's going to work down here. These pelvic nerves, which has to do with parasympathetic, in the detrusor muscle, they have a special receptor located for them, okay? These muscles, okay, these receptors are muscarinic receptor, okay? It's an M3 receptor, muscarinic receptors, okay? What happens is that in the muscular receptor, what is going to happen to this pelvic nerve? It's going to release acetylcholine, right? So when it is acetylcholine onto this, okay, M3 receptor down here, okay, what is going to happen? Release acetylcholine. That is going to cause the wave of depolarization to occur. Ultimate result is the contractions of this isthmus muscle. Contraction of the detrusor muscles, okay? So these guys, okay, let's just try it. Releasing this acetylcholine, it causes, okay, let's write down here, contractions of the detrusor muscles. Okay, that's what it does, right? Because remember, through this pathway, it inhibited right here, okay? Let's make this, okay, here, we can even make it down here, okay? Actually, let's not make it here. You just think about this. It inhibited this pathway, so that way, there's a relaxations of the bladder is already happening there. Okay, whenever this bladder is filled, and through this pelvic nerve, giving this with the M3 receptors, okay, this releases acetylcholine to the M3 receptors, and that causes a wave of depolarization, as I said, and then ultimately there's contractions of the detrusor muscles, right? Because what are we trying to do? There's lots of this urine is there, okay, and we want to avoid that. We want to, we want to discharge that urine from our system, okay? That's what we're doing. Now, not only this, remember guys, if there's a hypogastric nerve is there, okay, if this is inhibited, that is relaxing the detrusor. But at the same time, look, what is happening here? What is happening in the internal sphincter muscle? There's also less fibers is going to the alpha-1 adrenergic receptor, or internal urethral sphincter, right? That's what is also happening here, right? But this pelvic ganglion, okay, this is relaxing now. But also what happens is that this nerve also goes down here onto this pelvic nerve, also goes and, stimulates, let's say, this internal urethral, okay? Internal urethral. So what happens is that, but this nerve, okay, this pelvic nerve, when they go stimulate here, it causes, okay, because these guys are already relaxing because there's a decreased supply of the hypogastric nerve, okay, there's a decreased release of norepinephrine with this alpha-1 adrenergic receptor. So these guys are already relaxing there. Plus, okay, when there was a pelvic nerve, okay, that gives signals down here, it causes nitric oxide release. Okay, when the nitric oxide releases, what happens? The level of the cyclic GMP goes up, right? Ultimately, it causes what? Relaxations of this, of this internal sphincter muscle, right? So now what happens? So there's a contraction that happens in the detrusor muscle, okay, and there's a relaxations on the internal urethral sphincter. So when that happens, that means my urine is now coming down here. Okay, look, all this urine is coming down here now. Okay, what is going to happen now? Now, this guy, you see, remember we said from the pointing centers, not only this reflex, this is also coming down here. One is stimulating the parasympathetic fibers, S2, S3, S4, to the pelvic nerve, but at the same time, it also relays some signals to this guy right here. And what is this black right here? Let's write it on black. Okay, these guys has to do the somatic neurons, right? What is going to happen? Look, there's a positive stimulation here, okay, which is gonna stimulate the parasympathetic fiber. But they also your brain from your what is gonna happen is gonna negative signals to these somatic neurons. Okay, there's a negative signals to the somatic neuron. So whenever negative signals to the somatic neuron, what is gonna happen? This is my pudendal nerve, right? Right, and he's bounding with the nicotinic receptor, right? What is gonna happen? Level of, if it's inhibited, level of this, acetylcholine release on this, your external urethral sphincter, which this is, right, is the external urethral sphincter is reduced. Right? So release of acetylcholine through this nicotinic receptor is reduced. So when this reduces, what is going to happen? That means there is no contractions happening anymore. This is relaxing now, okay? So external urethra is relaxing. So what is going to happen? Because this is a voluntary control, right? So we voluntarily inhibited the somatic supplies to the external urethra. So what is going to happen? This external urethra, the striatum muscle, which get relaxes, okay? So now what happened? This detrusor muscle contracted, internal urethral sphincter relaxed, external urethral sphincter relaxed. What is going to happen? The urine will come out. Okay, now urine will come out. That's what is happening. Remember, sometimes, let's say if we have to, sometimes let's say whenever, let's say, we want to hold our urine. Okay? We can't just pee anywhere, right? So if we want to do that, what is going to happen? We can, from our prefrontal cortex, okay, we're just going to do what? We're just going to, this neurons, you see right here? We're just going to increase the activity of this hypogastric nerve, okay? So when we increase the, let's say, okay, whenever we increase the activity of because from there, what is going to happen? We're going to tell our pointing centers that, we need to hold, okay? So what is going to happen? That is going to give more signals coming down and stimulate this, look, the hypogastric nerve, okay, so the sympathic, and plus it also going to even further stimulate this somatic pudendal nerve, okay, so that way we don't void, okay, so we don't void anywhere, so we don't just urinate, you just don't urinate anywhere, okay, so whenever, okay, that's the reason why it is really important that knowing, okay, where to void, okay, so just letting you guys know, if you need to void in a particular place, whenever this is filling up, okay, you can, okay, through your prefrontal cortex, okay, you can voluntarily, okay, control, so that way you don't void or you don't pass the urine, okay.